Louder, baby girl.
Okay.
So, a little bit about me. My name is Arianna Romero. I'm a 10th grade student, and I'm a Girl Scout in Troop 51005, and I'm currently working on my goal to work for this. So, what is this? Why are you here? So, this is a presentation about stopping the stigma around mental health, and I chose to speak about this subject because it's such an important topic, and I feel it's often misinterpreted and misunderstood because mental illness is very serious and can be fatal in some cases. A lot of the time, people are scared to open up about their feelings, which can be caused by the stigma, which is why I would like to stop it to the best of my ability. So the topics in this are facts and myths, statistics, a video on different perspectives, a guest speaker, and then some questions at the end. Okay, so this one is like a little game. So instead of stopping your feet, because I know like most of the chairs are off the ground, you're gonna clap your hands, okay? So a fact is a thing that is known or proven to be true, and a myth is a widely held but false belief or idea. So if it's a fact, you're gonna clap your hands, not stomp your feet, or you can do both, I guess, if you can recently work, or you can wave your arms in the air if it's a myth. Okay, so fact or myth. Everyone feels sad, angry, or lonely, or scared at times. Okay, period. It is a fact. It's healthy to feel emotions, even the not so fun ones. Uncomfortable feelings let us know that something's not okay, and we can use that information to change what we're doing, ask for help, or learn more. Fact or myth. Getting angry is never okay. Wave your hands if it's a myth. Clap if it's okay. No stopping. Good job, guys. It is a myth. Yay. So all our feelings are okay all the time. It's what we do with our feelings that become a problem. Ask for help from a counselor or other trusted adult if you need it. Okay. Fact or myth. Getting enough sleep, water, and healthy food are ways to take care of your mental health. Okay. Good job. I hear a lot of clapping. It is a fact. Healthy brains work better. Kids and teens should get 8 to 12 hours of sleep, drink enough water, and eat fruits and vegetables every day. Fact or myth. Talking about my words will only make them worse. Wave if you think it's a myth. Clap if it's not. Lots of waving. Hey guys. Okay. It's a myth. When we keep big worries a secret, they tend to build up. You can talk with a trusted adult, support friend, or doctor or counselor. Next one. Kids don't have any real problems because they don't have to deal with all the things adults do. Good job. I'm already clapping. It is a myth. Things like school, family, friends, and just growing up can be hard. About 1 of every 7 kids experience problems that require help from a doctor or therapist. Okay, so here's some statistics. Super boring, but important. Anxiety is the most common condition with 60.1%, followed by depression 8.4%. Roughly 20% of adolescents report having unmet mental health therapies. Roughly 20% of high school students seriously considered attempting suicide, and 9% attempted it. Suicide is the third leading cause of death among 15 to 29-year-olds globally. 50% of all lifetime mental illnesses begin by age 14. Key drivers include bullying, family history, and high school and social media usage. Only about 20% of adolescents receive mental health therapy, though 55 reported discussing their mental health with a professional. 44% of parents believe social media use among adolescents rose from 7% in 2018 to 11% in 2022. So this video is kind of long, but it's like try to think of it.
Getting to somewhere where we can help people. And, the couple people that were around us all agreed with my friend. And I was like, maybe that's an idea. So at the age of 30, I went back to school and I obtained my associate's degree. I then went on to obtain my bachelor's degree. And So I've been working in this field about 12 years.
Hi, my name is Tara Story, and I am a nurse. I work with Healthy Transitions with adolescent mental health. So I started nursing about 5 years ago. I went back to school, and is what actually got me into this field versus any other kind of nursing is I was a student nurse, like an intern. So I got to go to all different floors in the hospital, and I ended up in Hasbro Children's Hospital and on a behavioral health unit with all adolescents, and it just kind of became my favorite place. Like I enjoyed working there, and I kept picking up shifts and going there, and that's kind of what started the ball rolling for me about 4 years ago to be working in the mental health field. So that's kind of a little bit of how I got introduced into it. And I also enjoy the age that I work with. I like working with adolescents that, you know, at ages like 15, and then currently I work to ages like 25 or so, and it's just a great age to help support adolescents that are coming into first-time health problems that they would have never thought could happen to them, or being an extra support for them, which has been very amazing.
I would say probably seeing somebody improve, their condition improve. In my part of social work, I deal with people that are really having bad days. Sometimes we deal with people who are depressed, really anxious, having some hallucinations, or even having thoughts of ending their life. So seeing somebody going through that and then eventually their life improving and they're making strides to improve their life, that's the most rewarding thing.
One of the most rewarding things is building the relationship with clients and patients. I think a lot of times people with mental health issues have the stigma thinking like nobody's going to believe me, or nobody wants to help me, or I sound, ridiculous if I say that I'm going through this. So I think it's really important to have a great relationship and have clients be able to open up to you and, say, this is what I'm feeling, and being able to help them. I think building trust and rapport is really important, and there very much is a stigma against people saying when they need help, and it's actually really important. I think now more than ever, especially in the teenage years, kids just have a lot going on, and they need to have people to reach out to and to know that it's not just them. I think a lot of teenagers, especially, middle school, high school, just think like these things are happening to them, and they just keep it inside. They don't say anything until it gets worse and worse and worse, and then they can't take it, and they're in, not as good of a situation. So I think being supportive and being there and showing that there are different programs, different support systems, and just being there for them to get to know you and trust you and be able to help them see that there's really, there's a lot of help out there, and there's a lot of supports that can be found, and no one should be suffering on their own.
Well, I think it's not something we're born with. I think it's something that is learned from as you grow, from the people around you. And again, it's taken society a long time to gain knowledge about mental health issues. So I think because as short as 10, 20 years ago, we didn't have a lot of knowledge about what depression really was and what causes anxiety, and so again, that fear of not knowing is a major cause. And I think it's also the way mental illness is portrayed in society, in movies, TV shows, or books. Often it's somebody who is mental illness is a crazy person and dangerous. Somebody you don't want to be around. And most of the cases, that's, the opposite is true. So, I think it's, stigma is in our society because it's learned as we grow, because it's in our, in the media, the movies and the TV shows. So I think, again, as we continue to have conversations like this and we point out that stigma is harmful, hopefully those things will change. And I think with people in your generation who are much more knowledgeable about mental health information, as you grow older and start your own families and become community leaders, I think we'll see stigma decrease quite a bit, hopefully be eliminated.
The stigma surrounding mental illness, there's not a lot of people that talk about it, and I think it should be talked about more, because I feel like if the younger generation knew about mental illness, especially like the one that I go through and the one that I know a lot of my friends go through, I feel like it wouldn't be so scary because they would be informed about it.
So I think, even with people reporting a mental health condition, so that's why I said in the beginning that number 1 in 5 is probably higher, and it is because of the stigma. So mental health is sometimes not always seen like a physical disability. So if someone's in a wheelchair or maybe using a walking cane or something, it's very visible, right? So mental health affects how we act and sometimes behave. So with that stigma, people don't really understand it sometimes. So people living with those conditions are less likely to admit that they have something going on. That they're maybe feeling like they're weak, or not being able to measure up, maybe at work or school.
So, and I was just talking about this the other day. I believe the stigma of mental health is getting better. I would say probably 15 years ago, there was much more stigma around mental health, but I think people talking about it and believe it or not, having people who have kind of social status, so even celebrities, athletes, politicians, those types of people talking about mental illness, showing us that it's not just, us, it can affect anybody, that has really kind of decreased the stigma.
Well, I'd like to eliminate it. That'd be the biggest thing, is to continue to work to get rid of the stigma. Stigma comes from fear and, a lack of knowledge about things. And especially when we're talking about illnesses in the brain, which is extremely complex and, hard to understand sometimes. And those types of things, lack of understanding and fear, bring out stigma, because sometimes it's just easier to have a negative feeling about something than it is to try to learn about something. So, stigma prevents people from getting help because they're worried about what other people will think, or they're afraid of what might happen because of that lack of understanding that getting help is a normal thing, is going to be a positive thing. So, stigma is something that is dangerous because it, as I mentioned, it will prevent people from getting help, and then the longer you wait to get help, the more serious your illness may become, and certainly could lead to, dire consequences. So, certainly, eliminate the stigma by continuing to have conversations like you and I are having, continuing to learn about mental health, and, increase our knowledge and eliminate our fear of the unknown.
I would say not criminalizing it. Again, going back to that case where the woman was either going to be locked up in jail or go to a hospital. I think having the police and EMS have a more in-depth training on mental illness and autism and what that looks like, as opposed to just labeling these people as criminals because they did something even a moment while they were having health issues. I think that could decrease the stigma. And the more people that know about mental health in general and about how we can get treatment for mental health would also reduce the stigma. One thing we're doing in Rhode Island, and I'm not sure if they're doing it in Pennsylvania, they might be, is we have what's called 988. 988 is an alternative to 911. So historically, people would call 911 when they're, you know, anytime they need, and they are in a situation of crisis, they would call 911. Whether it's a motor vehicle accident, or a fight with their husband or wife, or a mental health episode, they would call 911. Historically, EMS, the ambulance would come and pick somebody up and just send them to the hospital. Now with 988, we're able to dispatch clinicians to the home or to communities, to schools, to evaluate the patient's clients as we go home, and to see if maybe hospitalization could be deferred, meaning that maybe they didn't need to go sit into the hospital. Maybe it's something where we could set them up with a therapist, or a psychiatrist, or a case manager outside of the hospital. So having those resources, I think, alone would decrease the stigma of mental health. I'm happy I got into this profession. Looking back on the 15 years that I've worked, I don't regret it at all. I love helping people. It makes me feel good inside when I help people. But also, and this is a tip for this future social workers, is I have to remember that I have my own mental health well-being. So if I spend all my time trying to take care of somebody else, it's going to affect my mental health. So I have to find a balance of helping others and helping myself. And that's all.
Also doing more things like this, interviewing, keeping the conversation going. And I always say to have the conversation about mental health and wellness kind of on a regular. So maybe not when it's a crisis or something, or when someone is actually at the point where they're feeling bad or needing help, but just keeping a conversation every day in the home, amongst friends, just checking in and creating those safe spaces for people to be able to voice what they might be going through. And I always say, people sometimes shy away from having a conversation about mental health because they feel they don't know what to say. But it's okay if you don't know what to say, right? We have the world at our fingertips with our phone, and 988 is a really great resource. You dial it just as you would 911, so that is the National Suicide Crisis Line, but it's not just for crisis. You get resources. If someone just needs to talk to someone, you can call that number. So that's a really great starting space if you are unsure what to say and you're having that conversation with someone. But I always say don't shy away from the conversation if you're not sure what to say. Just say, I'm not sure. Let's look this up together. But the key is to keep the conversation going and everyday conversations.
Probably that, and I kind of mentioned this before, that all the way from the President of the United States, all the way down, people of all different professions struggle with mental health. And it doesn't mean that you're going to not prosper. It doesn't mean you're not going to, progress in life. It just means that you are going to deal with the mental health and achieve anything that you can achieve. Just like if you had high blood pressure or diabetes, it's an illness just the same. It just happens to be an illness in your brain. It's a mental illness.
So I wish everyone knew that, having a mental health condition is no one's fault, whether that be the parents or the individual. It is just like a physical disability. So if someone gets diabetes, sometimes it is situational, just like diabetes. So if you're going through a rough time, or if it's something that is like a brain imbalance, it's no one's fault, right? So it's okay to not be okay and to ask for help. So I wish everyone would understand that, and that it's okay to ask for help, and it doesn't make you weak or less than.
Something that I wish everyone knew about mental illness is I wish a lot of people knew how common it actually is. I think a lot of people tend to think it's just them and no one else around them suffers, and it's something that just has not been talked about for so many years. But I really think, in the past couple of years, with more programs coming along and more support, more community things, I think that has definitely been helpful for people that do need help to come and try to seek help. And also, there's so many more things now. There's so many more ways to be able to support people, whether it be, telehealth visits and versus not having to go somewhere, or community programs. So I think that's, we've really come a long way as far as mental health, and it's not as taboo to not say anything and pretend like you have nothing wrong. But I really wish people would kind of realize that it's not just, a them and their suffering alone, that there are more people that have gone through similar things and can help them along the way.
I think people should know that a lot more people that they know suffer with it that just don't want to talk about it. I think that probably everybody knows someone that suffers with it, but it's really hard to talk about it sometimes because they're fear of being judged, or they don't want people to look at them differently. But it's very common and it's nothing to be scared of. And yeah, I think that you should always tell a friend or tell someone that you feel comfortable with, like a parent. And yeah.
Well, I think the biggest thing everybody should know about mental health is that we all have mental health. It's really, to me, one of the most important parts of our being. A lot of our focus as we grow in society is around physical health, eating healthy and taking care of your body, exercising, and that gets a lot of focus. But really, without good mental health, you're not going to have good physical health. You're not going to be successful whether you're in school or at work, in the military. Really, everything in our lives focuses around mental health. And I think people should know that for those who are struggling with mental health illness, depression or anxiety or other similar illnesses, it's very common. And I think people should know that they should never, if they are struggling, struggle alone, because we tend to think I'm the only one going through this, or what will people think if they know I'm struggling? And it's really important to know that you're not alone. The majority of people at one point or another struggle with a mental health situation. So it's super important to talk about it, be open about it, share what you're going through with your family and friends. And the more we do that, the more we normalize those discussions, I think the better off we're going to be, and the safer people will be, and we'll have much better, healthy outcomes.
So now we have so this guy, I met him in Rhode Island while I was when I was at a mental health conference, and I talked to him. I was like, wow, this story was like, yeah, like I'll let him explain it because he explains it a lot better than me. But I just want to let you guys know that this guy is amazing and great, and really helpful. So I would like to introduce Mark Collins.
Speaking of amazing and great, Arianna, great job again, nice work. Arianna presented to about 100 or more students Brooklyn this morning at her mom's school and did a tremendous job. So she's really doing really great work in raising awareness and reducing stigma, and that's super important, and really proud of you. Great job. You're welcome. So, one of the things that came up in the video that Arianna was talking about when she was doing questions, the myths and the facts. So an important one that I like to talk about a lot of times too has to do with if you think a friend or a family member is really struggling and might be thinking about suicide, and people think, well, I don't want to bring it up because if they're not thinking that, then maybe they will if I ask them. And so they don't. But research and a lot of studies show that the opposite is true. That if somebody is struggling and is actually thinking about taking their life, and you ask them directly, I've noticed you're really struggling, are you thinking about suicide? That is a release for them. They feel like, oh my goodness, I've been carrying this, and somebody thought enough of it and actually asked me. And so the opposite is true. It's not gonna make somebody decide, you know, to go through suicide. It actually shows them somebody cares, and I can talk about this with somebody, and that leads you to finding an adult or somebody who can help. So don't ever be concerned about asking somebody. And the way you do it's important too. You know, you wouldn't want to say, "It's not thinking of killing yourself, are you?" Because they're liable to say, "No, no. Geez, how terrible does that sound? You know, what are you going to think of me if I said yes?" Okay, so you just want to be careful about how you ask. Really, just doing it directly with empathy is the best way. You know, are you thinking of suicide? And that's it. No judgment. You know, no kidding around, no nothing. Super important. And then the flip side of that too is somebody ever says to you, you know, in a joking way, that they're thinking, all right, maybe I should just kill myself. It's always important to take it seriously. You know, don't assume they're joking. Tell them that you're concerned that they said that. You know, let's talk a little bit more about that. Hey, let's go talk to an adult about that. Because it's great news if they weren't serious and it was a joke. Everything's good. But if you think it's a joke, maybe just let it be. And it wasn't, then obviously that's not a good situation at all. One of the other things Arianna talked a lot about is stigma and how much that hurts. So this is a graphic I found recently that contains a lot of information, but it just shows you some things, you know, some examples of what stigma sounds like when someone's struggling. You know, just smile. You don't have it half as bad as somebody else. It's all in your head. You know, just push through it. And those things don't help, and they hurt. They minimize what somebody might be going through. You know, but you don't need to solve someone's problems because most of us aren't equipped to do that. Really, what you need to do is just let them know and feel like, hey, I'm here to listen, I'm here to support you. I want to help get some help somehow. I can't fix it, but you know there are people who can. Just all those types of things that can reassure someone that they're not alone. And what they're going through is common. You know, 1 in 5 teenagers, you know, have a mental health condition, whether it's anxiety or depression, bipolar, or similar things. It's common. It's okay. And the more we talk about it like this, then the easier it is for people to feel okay about it and get help. So again, things you can do if you think someone's struggling. Listen without judgment. You know, check in on your friends if you think they're struggling. Sometimes that's all it takes. Just, hey, notice you haven't been at practice lately. You know, I'm concerned. Is everything okay? And then just follow up. So these are important things to help defeat stigma, encourage people to get help. So as Arianna mentioned, we met at a youth mental health summit that I was partnering to help put on. And so the reason I got into doing this kind of work was because my son Chris, who was 20 at the time, back in 2018, died by suicide. And he had been struggling with depression and anxiety for about 3 years. It wasn't something that was ever in his past. But when he went away to college, it just kind of started. He started with some panic attacks and escalated really quickly. And he got help. We all learned together about what was going on. And started on some medications, went through therapy, even hospitalization, took a break from school, worked his way back, and so forth and so on. Unfortunately, in the end, it took his life. You know, depression took his life. And we learned after the fact, letters we got from his friends, that he was actually supporting a lot of his friends even while he was struggling. So he was teaching them kind of what he was learning. And that was just the kind of guy he was. He loved his friends, he loved his families, kind of always the guy people turn to. Never wanted to be the center of attention, you know, like in a room, but he tended to be the person everybody kind of gravitated to. So he was, like I said, helping his friends, and we learned that through a lot of the letters we got. And a lot of his friends came to us and said, you know, there's got to be something we can do to help each other. You know, yeah, there are counselors and there are this and that, but we're around each other all day long, in school, or in practice, or in clubs, on social media, right? You're always chatting with friends. So that age group, you're going to notice when someone's struggling maybe earlier than a parent or a teacher or an adult. And so they were thinking, what can we do to help each other? So we were able to find this great student-led program that the University of Michigan developed, and we brought it to Rhode Island, launched it in 2 high schools back in 2018. And the premise of it is that a lot of mental health struggles start in adolescence, right? Starting in middle school and high school. And teenagers are going to be more apt to listen to messaging from their friends than they are adults. So, you know, we adults could explain things or tell things to our kids, but if it actually comes from a friend, they're more apt to hear it and listen to it. So this program basically teaches groups of students in schools about mental health issues, how to talk to friends, how to recognize signs and symptoms, you know, what are facts and what are myths about depression and anxiety and related illnesses. And then also teaches them how to go back to their schools and put on a year-long mental health campaign for their peers. So they're doing things like warning announcements and posters, they do videos, doing social media posts, they have guest speakers on stage, classroom lesson plans, you know, really a whole list of creative ways to kind of share the mental health information. So they're acting as, you know, advocates and educators in their school. They learn what the resources are in their schools and in their communities, so that when someone is struggling, they know where to turn to. But most importantly, is just keeping mental health discussions and visually active in their school and their community. So they're talking about it, they're making it normal, which is so important to ending stigma. It's so important for all of you to do after tonight, right? Don't let this be kind of a one and done thing. Hey, we go to a mental health presentation. Hey, we learned some things, you know, and then just kind of put it in the back burner and forget about it. So the way we eliminate the stigma is just to continue to talk about it. You know, and that's as easy as, you know, a few days from now, you know, if someone's struggling, just check in with them. Say, hey, you know, how are you? Really listening. Maybe a program to your school or a guest speaker, or just talking, you know, to your parents. It's one of the things that we've learned with working with so many youth. A lot of them feel like, I kind of know about my own mental health and what's important. It's like, you know, my parents don't, because they grew up in a whole different world than we're growing up in. You know, so it's kind of hard to have those conversations. So that's a great way to start things. I had a video statement that I wanted to share.
It is estimated that around 1 billion people around the world have a mental health illness, with anxiety being the most common, affecting 284 million people, or 1 in 5 persons. Unfortunately, regardless of its prevalence and rise, the stigma surrounding mental health remains firmly entrenched, with many still regarding and seeing mental health misunderstanding, of ignorance, and of prejudice. We need to learn awareness, to talk openly, to educate ourselves and others, and to encourage equality, to show compassion, understanding, and to choose empowerment over shame. For we all need to work together to dispel the myth and break the stigma of mental health illness. For we are all human beings, part of the human family. Thank you for sharing in this inspirational video and feel good. Don't forget to subscribe and don't let your fear of being labeled or discriminated stop you from seeking help.
So again, that just kind of hammering home the point about mental health struggles are common, nothing to be ashamed of. It's important to talk about it. Getting help early is always the best thing to do. So I'd be happy to answer any questions you might have about either youth mental health or our foundation. Art's also available to answer any questions anybody has. Thank you very much for listening. I appreciate it.
I would just like to say a big thank you to everyone wearing a black shirt with a big green ribbon on it. So if you look around, there's a few people. He is one of them, but he's not wearing a shirt. So I just want to give him a round of applause. Yes. So I'm just gonna point him out because I feel like some of these people don't know who they are too. They're looking at me like, who are they from? So we have my mom, my brother, Miss Jenny over here, my dad in the back, Miss Kathy, Miss Ben, and Miss Brandy. So a big thank you to all these people because without all of you guys, I wouldn't be able to do this. So yeah, thank you so much.
I think we should point out that more or less, Arianna has finished her Gold Award with this presentation tonight. And I think it's pretty obvious from the video and the whole presentation that she put a lot of time and effort and did a great job. So let's give her a round of applause.
There are goodies and takeaways on the table over here.
Oh wait, I almost forgot guys. So if you look around, there's a few on the wall QR codes, but there's also at your table. If you guys scan those, it's 4 questions. It's just like a yes, no, maybe so about this presentation. So if you can, just fill it out. And if you can't access the link, we also